All right, well, good afternoon. Welcome to the March 3rd virtual assembly. I'm Mitch with Wasac. Today we have a great presentation with Benton County and the Recovery Coalition. So we got Matt Rasmussen, Deputy Benton County Administrator, a lot of syllables, sorry. Jerome Delvin, Benton County Commissioner, and we got Michele Gerber, who's the president of the Benton Franklin Recovery Coalition, and they're going to talk all about this coalition and what's been going on and what they've been up to. So I'm going to kick it over to you three and take it away, please.
Oh, thanks. I'm starting first. This is Jerome Delvin, Benton County Commissioner, and I'm coming from Washington, D.C. I'm here attending the NACO legislative.
Is it sharing the screen there, Jerome? Sorry.
What's that?
Is it sharing the correct screen?
Yes.
Sorry.
Yes.
It's showing the not the full presentation, but just the PowerPoint with the slides on the side right now.
How about now?
There we go.
There we go.
Okay. Once again, Jerome Delvin, Benton County Commissioner, coming from NACO in DC. This is the NACO Legislative Conference. Good conference. So when I became a commissioner, I noticed, we of course run a jail, and looking at the daily jail reports of who was in and what was going on, that, and having been a retired law enforcement officer, I just, had a lot of contact with people, with mental health issues and drug addiction issues. And I thought, well, there's got to be a better way than using the ER rooms and the jail for treatment. It's not treatment. So, I started talking to local hospitals. I got no traction for about 6 years. I was just kind of floundering out there, talked to staff, like Matt looked at me with wide eyed and go, oh, well, okay. And because, in Washington State, counties don't normally run a hospital or anything like that, those type of services. But and then came along the Recovery Coalition. Michele Gerber had formed that Recovery Coalition. And as soon as I heard that, I was knocking on her door. Okay, this is something that can help, because now it's the community asking for this type of center. And we became partners with the Recovery Coalition. But at that time, an old hospital was sitting vacant. We negotiated a price. The county negotiated a price with the former owners out of Tennessee, who still run 2 hospitals in the Tri-City area. We negotiated a price. I think it was 1.3 million, maybe, or 1.6.
1.6.
1.6.
Yep.
That gave us 200,000 square feet of space to use. And then gotta give Matt all the kudos. He started looking for funding and grants, writing grants from the state. Michele, with her contacts in the state legislature, secured a lot of funding too. So I think we're somewhere around 42 million to build this center. We're at the point now of demolition and construction, and we hope to have it open up by the end of this year. So I think Matt's been going through some slides here, but at this point, I will turn it over to Michele to give her background on the Recovery Coalition.
Thanks, Jerome. Yeah, let's advance a few more slides. And one more. There we go. Okay. Well, I thought it would be important to say, how did this thing start out? Because it was really founded by 8 friends on my back porch. And how did we go from that to a $42 million project? So I was going to give some background on how we got there, and then Matt will talk about the project itself. But we formed a coalition, and we were, very tiny, completely private, volunteers. We take no payment. We've been in business now 7 years. We've never taken a penny of any payment for our work. We're all local. We have no paid staff, and we did form a 501c3. And our whole point was to promote opportunities for recovery from drug addiction and remove barriers to recovery. Because, you know, as you all know, this area of treatment is underfunded, and there's just not enough resources. Next slide, please. So the founders, all of us, had traumatic experiences with addiction in our families. And we also realized that a resident of Benton or Franklin counties dies of addiction every 5 days. We've since learned that in Yakima County, it's double that. It's every 2.5 days. And in Spokane County, it's every day someone dies of addiction. 5 to 6 per day in the state and 1 every 5 minutes nationwide. And over 40 million Americans are in active addiction, and many of them are employed. So the addiction is in every workplace, school, church, business, or neighborhood. If you've got 10 people in your business, chances are someone is dealing with addiction or their family is. Yet it is a treatable disease. We can do something about this. Next slide, please. The Surgeon General says that if we do spend money on treatment, we can save $7 to $12 in other social costs. And those would be jails, courts, ERs, EMS, foster care, welfare. So we're all paying for this. If you just look at this one photo, just think of the costs that are racked up right there with one incident where someone who was addicted fell asleep in their car, the car started on fire, hit another car, trucks had to roll, hospital time. Just think of the costs right there for one tiny incident. So we needed to do something because we're all paying for this. And there is no detoxification and no inpatient residential service in the Tri-Cities. So we are the only metro area in the state that doesn't have that, or at least we were. Now I understand a couple of behavioral health facilities have closed and other places are also without these services. And I guess building on what Jerome said, I also went to hospitals the first thing we did and thought that, we could persuade them to open a wing for addiction treatment. And it was absolutely not. They do not treat addiction. Next slide, please. So how did we grow? Well, we contacted our natural allies. Of course, the police and sheriffs and jailers and judges don't want to be dealing with this problem. They realize it's a revolving door. They don't like it. And of course, they're going to be partners. Elected leaders, of course, they're the ones getting the complaints like Jerome did. Medical and treatment providers, they really don't want addicted people in their waiting rooms. Employers, they want this problem solved because of costs. And, tourism and hospitality is affected if you've got panhandling all over your town. Schools, faith communities, others, all of these, we needed every part of it. And that's something I can't stress enough, is that you can't be stovepiped and get this done. Next slide, please. So our major theme and how we, I'll say recruited, that's not the right word, but how we got partners to come along board is to say the entire community will benefit if people get treatment, so that we are suffering if they don't. So it doesn't become a matter of, are you sympathetic to addicted people? Are you feeling, charitable about them? Yes or no, whether you are or not, you will still benefit if they get treatment. Thank you. Next slide. So what we did when we went out to try to, get partners and raise money, this is how we showcased the need. You will have reductions in crime and recidivism. You will have reduction in expenses in law enforcement, medical, foster care, welfare, and businesses who send their employees to treatment in Seattle or California. And you will have improvements in health and safety, marketability, job creation, attracting more health professionals to the region, and neighborhood revitalization near this old hospital. Next slide, please. So we said, what are our principles? Well, there is community pride. You build on that. The community can do better and deserves better. Our board of directors is all local. No one, brings an agenda from Seattle or anywhere else. This is all our local principles, so that we don't have a situation where people are arguing, well, in Seattle, they give out free clean needles. We don't have to argue that point because we have our own organizing principles that are based on local values. We offer solutions. We are not going to have low barrier custodial care that is scooping up all the homeless and putting them inside a building. No, it's people who really want treatment and are desperate for treatment and can't find it. That's our audience. Transparency and open meetings were very public. You've got to be a 501c3 or people will not donate because they need a tax receipt when they do donate. But anyone who donates, we give no advantage in marketing or commercial benefits to them. In fact, if they try to use our organization for marketing purposes, they are banned from our organization. We use a lot of social media and traditional media. We are bipartisan. We work with everybody. We are well organized. We don't call a meeting and waste people's time and tell jokes and, things like that. We do talk openly about addiction to reduce stigma, secrecy, and shame. I am the mother of a heroin addict who died of his disease. That's not a shameful thing to me. I'm very proud of my son. And when you start with that, other people will open up too. And then we celebrate. Next slide, please. We have fun. We have fun runs. We have receptions. We have breakfasts. And so that, you have to have some fun too in all of this. Next slide, please. So we knew that we needed a partner. A local nonprofit cannot do this alone. So we approached Benton County. Jerome Delvin said yes. It was just wonderful. He's the first person that said yes. And so since that time, we've been partners. We have a formal memorandum of understanding, and we do help with I won't say lobbying because we're not licensed to be lobbyists, but we advocate together. We testify. We help write grants. We just do whatever we can to be a partner. Next slide, please. And I did want to mention that I did write a book about addiction because I believe that we need a call to action. We need people not to be saying, the police are going to do it because they can't solve this. And we can't wait for research. Research is good, but it's not going to save anybody next week. And so I wrote a book about my experiences and what I learned and what I think we can do in terms of public policy changes to make it possible to make progress on this awful epidemic. So that's all I have. Thank you.
So my name's Matt Rasmussen. I'm the Deputy Administrator for Benton County, and thank you, Michele and Jerome. And so I'm going to talk a little bit more about the facility itself and what we're working on specifically over there. So like Jerome mentioned, we purchased an old hospital building. We call it the old KGH for the Kennewick General Hospital, and we're doing phase one of, I don't know how many phases we'll ultimately have, but we've got a lot of space there and we're only touching a small portion of it right now. And so phase one for us is going to consist of 4 services that are going to be built in this facility. A crisis relief center, so that's your less than 24-hour, very low barrier to entry facility that gets people in, gets them stabilized and assessed, and then moved into the appropriate levels of care. A crisis stabilization unit, that's a little bit higher level of care, typically 3 to 5 day stays. People primarily with mental health or co-occurring issues are going to go there. And the crisis relief center, that'll have 20 recliner chairs. So they don't do traditional beds there, they do recliner chairs. So we're going to have that. That's a relatively new model in the state. The legislation is only a few years old, and the rules around operating just came out in the last year or so. So we're going to be one of the early adopters of that particular program. But it is a facility that Commissioner Delvin and I have seen in other areas that works very, very well. So we think that that's going to be something useful to our community. The crisis stabilization unit, that'll have 16 beds within it. Then next on the in the first phase is going to be as withdrawal management. It does say secure on the slide, but we will have the ability to do unsecured, but we did want that involuntary component at this facility. So people who are detained by the courts or a designated crisis responder can be detained at this facility, and it is a secure and locked facility. So that facility will also have 16 beds. And then the last one that we're doing here in phase one is the inpatient substance use treatment. And so that'll be 16 beds for people who aren't familiar. That's, most people equate that to a Betty Ford clinic. And that's a much longer stay, typically 30 or more days there that people can stay and seek a longer term drug treatment on their journey to recovery. That one is completely voluntary. I think there are very limited circumstances where it can be involuntary, but it is being in our facility built as a voluntary facility. So those are the first 4 programs that we're standing up with phase one. Here's a few of the slides. Unfortunately, I don't have a lot of pictures of what it looks like now, but it was a old hospital facility that's probably been remodeled 100 times, originally constructed in the early 1950s. And so this is the renderings from our design build team of basically what we can expect to see when we finish this facility. So we've got it. It's going to be a complete transformation over what it is today and what it has been for a long time. So our goal with this is to provide what we call a no wrong door model. And so that's something that we've seen. I saw down in Tucson, Arizona, and Phoenix, Arizona, when Commissioner Delvin and I traveled down there to tour some facilities. And basically, it's 24 hours a day, 7 days a week. However you come to the facility, whether you walk in, you're brought by law enforcement, transported by emergency medical services. It's supposed to serve as an alternative to incarceration or ER. So people who, we don't want to have our police officers having to, lack of a better word, make up a crime that they committed to take them to jail because there's nowhere else to go, or transport somebody to the ER because we can't leave them on the street, but they're not really in any health danger. We want them to be able to come here. The no wrong door philosophy also speaks to that our provider is going to be instructed we want you to find reasons to admit people, not the other way around. So the county is going to make sure that we have some funding in place to help those who maybe don't have insurance or need a place to go for a little while, but can't get funding another way through Medicare or private insurance or some other means. We want them to have at least that first 24 hours of treatment and see if we can catch them and get them on a path to recovery. So, so the initial phase, we talked about the 4 services. That's just repeated here. One of the big things we're working on in this, in addition to those 4 services, is how do we help people who are on that recovery journey get a transition back to the community? And so a lot of the times what we find when we see people who are our constant repeat offenders, for lack of a better word, is they don't have access to employment. They don't have housing. They don't have training or skills or, know how to balance a bank account or anything like that. And so we've been working with the Columbia Ability Alliance here locally, and they have programs that they do. They primarily work with developmentally disabled people, but they are definitely interested in expanding their programs into this realm. And so they do vocational training, life skills training, skills coaching. They help you write a resume, teach you how to balance your checkbook. And so one of the program enhancements we're doing here is we're building a commercial kitchen, which they will operate under a program they call their Opportunity Kitchen. And they do back of house training for hospitality and food service. So it's a 12-week program that they put their students through, gives them that direct job training and all of those life skills and life coaching training. And so they are going to operate that out of our building in the kitchen. And in addition to that, they will provide the food service for everybody in the building. So I don't know if anybody is local to the Tri-Cities, but They are operating right now out of the Richland Federal Building. They do an amazing job with their food and their catering. So I always like to tell them we're going to have the best food in any behavioral health facility in the state. But the partnership there is really going to be, in my opinion, very, very important to get people, catch them as they're exiting our facility and give them that last little bit of lift that they need to hopefully not come back. I mean, that's our goal. We would really like them to maintain their recovery beyond what we have in our facility there. We also have some work going on through Michele and her group. Again, they are out advocating in the community and attracting a lot of attention from donors. And one of those donors was the Columbia Center Rotary. They donated $250,000 to go towards building a family support room. So that's somewhere where people who are staying in the facility can have their family members come. They can have a birthday party. They can cook a meal together. They can spend time together in a fun, family-friendly setting. So it'll be a room within the building, but that's separate from the treatment areas and things like that to make people feel more comfortable. Another one that's not specifically mentioned here is there's a private donation from a member of the community for another $250,000 that's going to go towards building a wellness room. So that's going to be a place with some exercise equipment and a large open area for hosted exercise classes and give people an opportunity to be physical and connect with each other through some sort of physical activity and yoga and the different types of things they have there. So again, these are things that the Recovery Coalition is really helping support, these enhancements to the thing that's beyond just the basic treatment services. And we feel like that's going to be a really important part of people being successful in their recovery journey at the Recovery Center. We have a lot of collaboration going on in the community. One of our, we're partners with Franklin County. They have contributed some direct capital funding to help with some of those program enhancements that I just talked about. And they also are going to be supporting this project from the operational standpoint. We're working on an interlocal agreement with them. We have a river that separates our two counties, but as we see consistently, people travel back and forth based on where the services are. And so having that collaboration between the two counties is going to help make this project very successful. We also have a lot of support from our local cities. This has been an amazing project in that we don't have any of the not in my backyard mentality going on here. The city of Kennewick, where it's located, has been out in front with us saying, yes, we want this to come to our community since we first started talking about it. And then we've done a lot of public meetings and a lot of media, and nobody in the area where this facility is located is coming forward and saying we don't want it here. In fact, we're seeing the opposite in that businesses are already starting to relocate to that area. Most of them are in the behavioral health realm, but they're relocating to that area, anticipating that this is going to open and being able to provide those services for people who are in our facility or leaving our facility. And so, as Michele mentioned, it's going to economically revitalize that area of the city of Kennewick, who lost that major employer when the hospital moved out of there several years ago. So I mentioned the bi-county collaboration. We've been working very closely with Franklin County on getting this one up and running, and several other behavioral health related programs that are going to tie into this. We're working on standing up a field responder program. So that'll be an alternative to law enforcement and EMS in the community to go out and engage with people who are having a behavioral health crisis and not necessarily a threat to themselves or the community. And so they don't need that heavy level of response. We can have our team pick them up and then bring them back to the recovery center and get them started on that. And so that Cross River bi-county collaboration has done a lot to make sure that this project's going to be successful. We got the cities, they're each committed, in addition to just being supportive partners. The cities of Kennewick and Richland, who are our two largest cities in Benton County, have contributed all of the funding that they're getting through the opioid abatement settlements, have agreed to contribute that to the recovery center. So we've got interlocal agreements with them. They are sending those dollars to the county to be used to pay for construction and operation of the recovery center. And so that shows that their commitment to this is very, very strong. We're talking, between the two of them, a couple of $1 million a year that they're committing to us. And that's been tremendously helpful. And the partnership is really solid between our three organizations. Here's a outline of the schedule, and we are doing a progressive design build project. So we have a schedule that has a lot of overlapping, but where we are right now is we are well into construction in the demolition phase, and they are just wrapping up the last little bits of the final design. And so we were hoping to have that all done in October, but we've had some last minute changes that required some redesign, but construction progresses at the same time. So we're still on track for the end of the year finish. That is what we are expecting to wrap up construction is December of this year. And then we're going to be transitioning into operations as quickly as possible. We're already meeting with our provider to start talking about when they can start gearing up and starting to hire and buy the materials and equipment that they need to open those doors just as soon as we can after we get handed the keys. It's funding sources. So we have worked very hard with the Recovery Coalition, the Benton County and Franklin County to weave together a variety of funding sources. So quite a few of these are state competitive grants that we've been able to secure. We've also secured 3 different direct appropriations from the state for various components within the Recovery Center. We have a federal congressional directed spending grant that we secured for this project. And then the counties themselves have contributed a little over $16 million from their local funds. We both have a 0.1% mental health and chemical dependency sales tax in place. And so those dollars are going into this construction component. As Jerome mentioned, we're just over $42.5 million total combined funding to build out those first 4 services. And then we also did put a little bit of housing dollars into where we're starting as phase 2, which I'll talk about here in a few minutes, but you can see that at the bottom of that chart. And so I know a lot of you have worked on grants and stuff, but it's been a lot of work to weave all of those various funding sources together, but it's really worth the effort. And if you can pull it off, it's great. It's a challenge because these facilities are not cheap. And so it's going to be very hard for one funding source to pay for everything. I think that's kind of reflected here in the spreadsheet of how many different pots of money we have going into this one project. So I talked a little bit about the mental health and chemical dependency sales tax. Current fund balance for Benton County, and I apologize, I don't have Franklin County's up-to-date information for the slides today, but we have about $14.5 million that we've collected. That tax has been in place since 2022. So we anticipated that we would need to have some dollars for construction, and then we wanted to have a good cash reserve for when we started operations. So we are on track for that. We've got about 7 million of that 14 is dedicated to the construction of the facility. So that fund balance is going to start going down quickly as we really ramp up the construction here over the next few months. We're anticipating that it will fully fund the operations of these first 4 services. So that's was the goal, and that's what it should do based on the projections that we're seeing. We also are funding therapeutic courts. We had a therapeutic court program that was funded by our public safety sales tax, but we wanted to expand that. So we added an additional 1.2 million annually this year and starting in 2025 to those programs to expand the number of participants within our therapeutic court programs. We're also doing the adult drug court expansion. So we did do that. It says considering, but we did do that also in 2025. So we added another $250,000 to our adult drug court. That kind of serves as a pipeline for us to get people into our recovery facility and the housing that we're looking at adding there later. Providers. So we went out in 2023 and did a couple of rounds of RFPs to find a provider for this facility. And so I will say that there aren't a lot of them operating right now in Washington State. So we didn't get a ton of responses. I think we really had about 3. And then when we did the second round from the 3, only 1 ended up submitting a final proposal to that. And so that was Comprehensive Healthcare. They are going to operate all 4 of those services initially under one contract. And we're working right now. I actually just sent them a draft of the operations agreement. And so we have that final layout. They are going through that again one more time to fine tune their budget and their staffing proposals to update anything that we need to change from the original proposal. we're targeting executing that contract with them in 2025. Right now, it's probably going to be around a $15 million annual contract, but about half of that initially will be paid from third-party payers, so Medicare, Medicaid, private insurance, and the county will have to pick up, or the counties will have to pick up the other half. And then over the years, as the services ramp up and they are able to get more people who have those third-party options, that percentage shifts. And it gets down to about a 70-30 split by the third or fourth year of that. So it's going to be a big lift for the counties initially, but we hope to get some of those costs shift over to other paying sources as we get the facility up and running strong. Our construction team, as I mentioned, just wanted to make sure that they get some recognition here. We are doing a progressive design build project. So for those of you who have done them, it requires a presentation to the Capital Projects Advisory Review Board and approval from the state to do that. It is the second progressive design build project that the county is doing. I think now we're up to 4 after this one, but so we have a great team in Boughton Construction. They have a local office here, but they're primarily based out of Spokane, and then NAC Architecture also based out of Spokane. And so we all meet every week and have been meeting every week for about a year and a half to keep this project going. So I just want to make sure they got some recognition in our presentation today for what the amount of effort that they put in. And I will say to them, you know, they've also recognized the value of this project in the community and are contributing. They've done donations and things of their own to get this project going to where it needs to be. So it really shows, again, the strength of support that we have, even from the people who were paying to do the work are kicking some of that back to us to support this facility. So a few other things to talk about. As Jerome mentioned, we have just short of 200,000 square feet of building space that we purchased. It's an 8.5 acre site. So we're looking to the future as we wrap up phase 1. What are we going to do with the rest of this facility? We don't want it to sit empty, and we definitely want to make it a behavioral health treatment campus is our goal here. And so we are working actively right now on trying to find funding for recovery and transitional housing. The county put in $1.5 million from its housing fund to fund the design work and the initial demolition. So that is currently ongoing. Our first phase of that will have 35 residential units. So that'll be a really good thing. We're right now sitting at like a 98% occupancy rate for that type of housing in our community. And so people are waiting 6 to 10 weeks to find placement in housing if they need it. And we want to see if we can move the needle in the right direction on that. Another one that we're working on is some sort of youth crisis treatment. That's a service we don't have in the community. We want to continue to expand that vocational training opportunities for people who are in recovery. And so working with our partners in industry, being able to have a training room there, a computer lab, different things like that to keep people in that recovery journey, get them back to gainful employment and out back into the community. And then the last program we are looking at is a child long-term inpatient facility or a CLIP facility. Again, we have to go out and solicit funding for that. And then a lot of that is going to also depend on how much money the county has available for operations. So things that we've been talking about, want to do, but are still a little ways out from actually getting completed. And a lot of this is driven by something that the county commissioners created, and we have a bi-county behavioral health advisory committee. So when the 2 counties decided to implement that sales tax, the commissioners on both sides recognized that they needed expert advice on what is needed to be stood up in the community and how those dollars should best be spent. And so they created this joint advisory committee. There are 17 voting members. They represent law enforcement, emergency medical services, mental health experts, substance use disorder experts, people with lived experience, and then a handful of members just from the general community. And so we meet once a month. It's actually been a great group of people to work with. And so they have 4 standing subcommittees. You can see them there on the different areas that they focus in. But 2 of the biggest ones that we're working on right now are communications and workforce development. So we need to make sure we get, one, the message out about what this facility is going to be and what the community can expect. And they're working really hard on a branding effort for that right now. And then workforce development is a key issue that this community recognizes needs to be resolved, and that we don't want to have our facility open and steal employees from all of the existing services in the community. We want to supplement them, not replace them. It's been something we've been very clear about, is we want to be an addition, not a replacement to. And so this committee's been able to successfully work with the Columbia Basin College here in town, and they stood up or opened back up one of their Michelle, what's the program? It's a substance use
disorder professional.
Right. So they've opened back a bachelor's degree program in the community that had been they mothballed that previously, and they opened that back up based on the interactions with the committee members and then showing that there was a tremendous need for those type of people in the community. So talked a little bit already about that. They really are a big driver on what do we do with the dollars that come into that. And so they provide a perspective on the need and effectiveness of the services. They make recommendations on our contracts. They're going to be auditing these contracts, looking at the metrics of data that we collect, and giving the commissioners advice on whether or not they believe that our dollars are being spent effectively, and whether or not the programs that we're funding are the best use for the dollars in the community. And so I think that's going to be a really great tool to have, because I'm not a mental health expert or a behavioral health expert, and having this group who's looking at it and involved in it every day, telling us, yes, these things are working, or no, they're not, or you need to go on a different path, is going to make sure that we're spending the community's dollars in the best possible way we can. So these are the current projects that the committee is working on. I mentioned the field responder program that came directly out of this committee and their recommendation that was a need in the community. And so the county is standing that one up, but that was their recommendation. They are doing the branding effort. We're using our own communications staff for that, but the committee is driving that for the Columbia Valley Center for Recovery, and then the workforce development, which we already talked about. So that's a whole lot, but I'm happy to answer anybody's questions that they have at this point. Let's see if I can, so I can't see the hands raised or anything like that. So yeah, feel free to raise your hand or just unmute and ask questions if anybody has them. Yeah, Mike.
Hi. Commissioner French from Clallam County. County also very hard hit by the opioid epidemic, as I'm sure many of us are. Really impressive work. I really appreciate how detailed you were. Do you feel like you're scaling up to the necessary amount to actually really make a huge dent in the issue? Because I think one of the issues that I see is there's a lot of good ideas out there, and rarely do we actually scale them up to the amount necessary to really create big change.
So when we started this, we engaged early on with some providers, and I forget the name of there's a program or a study out there, and they give you kind of a formula that you can use to say, hey, if I have this many members in the community and these factors are involved, here's how many beds of these services that we need. And so we based the number of beds we wanted on that. Just me and Michelle, you can certainly chime in, or Jerome. I think this facility is going to fill up pretty rapidly. And I think that, there's going to be a need for more beds in the future, especially because we aren't going to just serve our Tri-Cities. We're going to collect people from the surrounding counties who don't have these services. So we definitely are having those discussions at the committee level and the county level, and recognizing that, yeah, I think this will make a dent. I think it's going to help, and it's going to make a positive move. Is it going to be the last of these that we build? I don't believe that to be the case. I think we're going to be looking at additional facilities in the future, but I think, we'll evaluate that as we can. And yeah, unfortunately, I get exactly what you're saying, but if we tried to build it to what we thought we needed forever, it probably wouldn't happen at all. And so we got to start somewhere.
This is Jerome. I would agree with Matt. I mean, one of the issues that we've come up to is licensing. How many licenses one entity can have and how many facilities, because then you get into the realm of you're institutionalizing people. And so that's a tricky thing to get around. But Matt's correct. you know, it's a good start. I think it's a really good start because there's nothing now. So yeah, I think it's a really good start.
Yeah, that's a good point, Jerome. I didn't even mention that in the presentation. Is one of the big hurdles we had to overcome, and ultimately we're successful in overcoming, was a designation as an Institute for Mental Disease. If you get designated that, your facility cannot qualify for Medicare or Medicaid funding. Now, right now, Washington State has a waiver in place, and they could pay for that, but that doesn't guarantee that forever. I think the current waiver expires in 2028. And so you have to get approval from the Department of Health and the Healthcare Authority. They limit you to 16 beds in any one of those, in those facilities. And if you combine them, there's a chance that they would count those beds all together. So they were initially going to count us as a 48-bed facility and potentially classify us as an Institute for Mental Disease. And so we spent a lot of time working with the Department of Health and our provider and going back and forth and showing them how, even though these facilities are located in the same building, they are going to operate completely and totally independently of each other. And eventually we were able to convince them of that. And they gave us approval that these are not institutes for mental disease. And so we maintain access for that funding. So that was a lot of work that I didn't even mention in the slide. So thank you, Jerome, for bringing that up. Commissioner Lindy.
Yes, thank you. LaDon Lindy, Yakima County. Appreciate the presentation. Obviously, you're a neighboring county, so we're looking at this with great interest. One of the questions I have is you talked about the input costs to get this up and running. Maybe you talked about it, maybe you didn't, but do you foresee that there'll be additional funding that you'll have to input into this facility on an ongoing basis? Or are you hoping that the payments through, Medicare, Medicaid, and other service or other providers are going to, take care of that?
So we're definitely anticipating that there's going to be need to maintain funding for ongoing maintenance and keeping the facility up. Our contracts with our providers are going to put some of the maintenance of the facility onto them, and we're going to take the major systems on. And my plan right now is to set aside a small portion of that 0.1% of 1% money that comes in a separate fund to make sure that those things are taken care of so that we don't have a deteriorating building going into the future. We're talking through the fees for service part of it right now as to whether or not there's value in us charging rent for this place so that they could pass that on to those third-party payers or not. And so that's a discussion that I'm having with the provider right now, is to see, if we charge you that rent and then collect it and put it back in, or are we better off not charging that, having a lower fee for service and just planning to take that money that the county would spend anyways and just set it aside. So we're working through that piece, but yeah, definitely planning for the future, because we have a facility that we own that didn't plan for that, and we're investing $20 million into rehabbing that one right now, and I don't want that to happen here. So
Thank you very much.
Hey, Matt, can I add one thing to it?
absolutely, you're a commissioner.
Well, first of all, I think we should give Yakima a deal since they have a Nordstrom rack in Yakima and we don't. So I think we should give them a deal. That's what my wife said. So, hey, with all you commissioners out there, one thing too on this is we're doing it as a design build. So I would recommend you commissioners, when you guys do county projects, that you do design build to where we know, okay, hey, the change order costs the contractor $10,000 plus their markup. Instead of a $10,000 change order, they're billing us $100,000. And so basically that's what we're doing with this project. Is it's a design build. Yeah, everyone needs to make money, but it's an honest portion amount of money. So we're kind of doing the same. We're doing the same thing for our juvenile justice center as well. And so I would encourage all you commissioners, bug the cities, bug the counties on your future projects to where it's saving you guys money for county projects as well. Because again, when we were doing the new administration building that we're in right now, we got this massive change order. I'm like, holy moly, this shouldn't be it. It should be way lower. And so a lot of our Benton County projects now are all design build, time and material projects. And I would encourage all you commissioners to push that route as well down the road.
If you have, like I said, I think we're on our 4th or 5th one. And so if any of the counties have questions or interested in that process, I can reach out to me or Commissioner McKay or Commissioner Delvin, and we can connect you with our capital team who's doing really well on that.
Yeah.
Well, if there's no other questions, I'm not seeing any in the chat. I'm not seeing any more hands up or mics unmuting. I'll give it another minute and then we can let it go. But for now, thank you so much. That was an amazing presentation and some really good information. So again, this will all be available on our Learn page of WASAC's website. So if you go wasac.org, and there's a little Learn tab at the very top, there is all of our virtual assemblies and the downloads for going back years, actually. So you can sleuth through there if you'd like, but this one will be up there hopefully by the end of day today. But still not seeing anyone unmuted or hands raised. Oh, Commissioner French, great work. Everyone involved, thanks for sharing. But yeah, so we will get that information out to you all. You can all find it online. And with that, I'll say thank you and have a great rest of your Monday.
Thanks,
Thank you all.
Mitch, and thanks everybody for listening in.
Thanks.
Take care, everyone.